Well, good morning to you, everyone, and welcome here to IVA. Let me do a little introduction here. We will soon be listening to Pascal Soriot, a man whom I know quite well, but in other roles than from IVA. And in this time, we will have Eric wish him welcome on the scene there. Now, the Academy, as you know, is called the Royal Swedish Academy of Engineering and Economic Sciences. We aim to be a meeting place. I think this is a good example of that. When we, based on science, are attempting to participate in public debate, write articles, have working groups, and deal with the big issues of our times when it comes to policy making and regulation. And in general, we do that, or I should say always we do that based on science and on the knowledge and the presence of all of our members in the Academy. I usually say this is a place where if you have any question on anything, you will at least find 10 members who are experts on it, and therefore will be able to contribute. Now, we do seminars, we do many of them, this is an example, and we also have the Business Executives Council with Eric Lautman, who have breakfast meetings with us and very famous guests. So, Eric, most welcome.
Thank you very much, Leif. And for me personally, this is a big morning because it's my last occasion where I'm hosting a Business Executives Council breakfast in an unusual setting, Pascal. So you are a really rock star because we never had so many attendees in any of our breakfasts before. And you may ask yourself why, but I'm sure nobody here will have any doubts after you have given your presentation. The Business Executives Council is one of the two arms of the Academy. And we have some 240 companies as members. We are not elected, but we are members. And we are members because we like what IVA stands for. And we work in this triangle between the politics and the academy and the business. And we would like to, the common denominator for all of us, I think, is that we are interested in development, interested in society and the interchange between these three elements that I was alluding to. So now we have an unusual situation where we have a real international chief executive coming to see us. Pascal, you have not been living in France for what, 20 years? 30 years. And we talked a little bit about your experience of France, and you will obviously speak for yourself in a while. France is a country which I think very many of us feel very much for various reasons, not only for the food, but we are also very excited about your company, because you may not know that, but when I went to business school, Astra was actually given as a good example of the first-class companies, first-class accounting by our late Professor Sven Johansson. Always used Astra as a good example of companies, how companies should present themselves in the annual report. So not only because you have great substances historically and also now, but also because you have always been a well-managed company. So with those words, Pascal Soriot, please, very welcome on the stage, and you will all be able to ask questions to Pascal once he's concluded his presentation. Thank you very much.
Thank you, Eric. Good morning, everybody. Thank you. It's really a pleasure to be here, but you've made me nervous now, you and Leif. Lots of people here this morning in this audience. This is the Academy of Science, the Academy of Engineers. This is quite an impressive place to be, and then speak in front of my chairman is also very impressive. And you've almost given my age away a few minutes ago, so that is also impressive. So it's really nice to be here. AstraZeneca is a company I joined 3 years ago, and as Eric said, I left France about 30 years ago, and I actually spent a fair number of years in Australia. And in Australia, and this was a long time ago, I was young in the industry, and in Australia, Astra in fact, Astra always was a very admired company, and I always saw Astra as one of the, if not the best company in the industry. So when I had the chance to join 3 years ago, it took me a short while to decide to join, because clearly a company I always had been dreaming of joining. So let me tell you a little bit about AstraZeneca, and essentially transition we are going through. The industry is, I believe, at a sort of a turning point, a unique time point in the history of medicine and the industry as a whole. Over the last few years, thanks to the advent of a number of technologies, the productivity of the industry, R&D productivity, has been improving. But at the same time, as we all know, economies are not the strongest, and payers are finding it difficult to finance healthcare. So there's enormous pressure that is applied to the healthcare systems around the world, and in particular the pharmaceutical industry. And so a number of companies have responded to this by saying we have to retire R&D, we have to reduce costs, we have to shrink, we have to consolidate. We have decided that the way forward is science, better science, more innovation. We're not, of course, we manage our costs like everybody else, but really we believe the way forward is science. The challenge as a company, which is really more specific to AstraZeneca now, is that over a period of 5 years, from 2012, let's say, to 2017, we're losing about $16 billion of sales out of $30 billion. So we were a $30 billion company in 2011. We're losing $16 billion of sales and absolutely nothing we can do about it. We're losing those because of patent expiries. And in the US, when you lose patent protection, as you may know, or maybe you don't know, in our industry, you lose your business in about 6 weeks. So you have a product that may be a $2 or $3 billion product. In about 6 weeks, it turned into 20 million. And you've lost it all. And that's basically how the industry works. You make money for a period of time, and when you lose your patent, you lose it all. And so we're losing 16 billion, and essentially we have to run very, very fast to replace this and rebuild our company. And that's what we've been doing over the last few years. And essentially, as I said, focused on science. And as you can see here, this is our motto, what science can do. And the entire organization is focused on innovating and doing better science with better scientists. We essentially have a purpose, a very simple purpose as a company, and we try to focus all our employees around this. And our purpose is to push the boundaries of science to deliver life-changing medicines. Easy to say, difficult to do. You have to have great scientists, you have to create an environment and a culture that favors science and encourage people to do good science. But this is really what we are about, life-changing medicines. And we have very simple shared values. We try to run a model that is decentralized and create autonomy as much as we can. So we have autonomous units, but we ask them to share a few things. Of course, common accounting systems, as you can imagine, common IT systems, but most importantly, shared values. And we've had to integrate quite a number of units that were completely different. And essentially, we've tried to drive a common approach to shared values. And the most important one is we follow the science. In our past, we tended to start from the other angle, start from the commercial dimension, start from the market and try to understand the market. We've completely changed that, and we follow the science. And I'll give you an example of a product in a few minutes, which is quite topical, actually, considering who actually won the Nobel Prize this year for chemistry. It's a PARP inhibitor, and it's a product that we did stop a few years back, a PARP inhibitor for ovarian cancer and possible breast and other indication. We stopped because we looked at it from a commercial viewpoint at the time. So one of our key values is we follow the science. The second one is we put patients first. We actually cultivate a mindset of really putting the patient at the center of everything we do. We play to win, which means we make choices. We try to make choices and invest for success and focus the organization. We do the right thing because, you can't have rules for everything. And of course, we do have some rules. We have compliance books, etc. But you can't have rules for everything. And we try to educate our people. We try to create an environment where people ask themselves constantly, what is the right thing to do here? What's the right thing to do? What should I do? And finally, and I tell you, I'm sure you know that if you run large organizations, being entrepreneurial in a large company is not always easy. But we try to be entrepreneurial, and I'll show you an example in a minute of where AstraZeneca is very, very entrepreneurial. And we have, over the last 2 or 3 years, moved from operating as a large organization to operating more as a small, nimble company. We're not always nimble. We have our own bureaucracy, but we are able to move extremely quickly. In fact, I see everyday examples where we move faster than biotech companies. And we have a bold ambition, which is, again, very simple, and we have been communicating around the company about this one. Very simple, but this is really what everybody comes to work every day to achieve. And by 2020, we want to be a leader in 3 core disease areas where we focus, and I'll show you those in a minute. We want to deliver 10 new medicines to patients, and anybody who knows the industry knows that 10 means a bit more than 2 per year, and anybody who knows the industry would know that there's no company that has delivered that ever in our industry. Launching 2 products per year for several years in a row is close to impossible. I've never seen this before, and that's what we're trying to do. In fact, we believe we can do it, and in fact, we may be able to do more than that. As a result, we want to improve the lives of 200 million patients and be a $45 billion company in 2023. So this $45 billion number has become a bit of a myth because we communicated that number last year when we were approached and offered to go and wed someone else. We didn't really want to get married at the time, so we said no. And as a result, it actually led us to communicate what our long-range plan was and communicate this $45 billion number. And a number of people have criticized us for it and said we can't achieve it. We're at about 26 billion today. We believe we can do it. We've just finished our long-range plan, and it reconfirms that we can achieve it. It is certainly an ambitious goal, but we think we can get there. Let me just give you a few data points relating to our company. So as I said, we are about $26 billion in sales today. We have close to 60,000 employees. We spent $4.9 billion in R&D last year. In fact, in 2012, we were spending $4 billion, and the plan was to decline this to $3.5 billion. Last year, we spent 4.9, so increased it instead of decreasing it. And this year, we will be spending about $5.8 billion in R&D. So we have a massive investment in research and development. And that massive investment is paying off because our productivity is actually good and our pipeline is very rich. We have 118 projects in clinical development. We have 13 NMEs in our industry. The lingo word is NMEs, new molecular entities, meaning new projects, new products in late-stage development. We have 850 collaborations and partnerships globally. We try to encourage our scientists to collaborate. We can't find everything ourselves. Science is a big, big ocean, and we can't do it all on our own, so we try to collaborate with great academic organizations and biotech companies around the world. We have manufacturing in 16 countries, but there's one place that matters more than the other 15, and that's Sweden. And I'm not saying this because I'm here in Stockholm, but in South Italia we have a massive manufacturing base, and a great part, about 40% or so of our global volumes are manufactured in South Italia, and we are continuing to invest in the site there. We are the 3rd fastest growing pharma company in the top 10 in the emerging markets. And very importantly, we are the 2nd largest in China. And we actually have the fastest growth rate in China. Last year we grew the fastest, and this year we grow the fastest. And we might become number 1 this year potentially. China is slowing down, as you all know, but we're still growing faster than the market. So a very important country for us. So I told you we decided to focus on 3 core disease areas. Before this, we were a little bit scattered in many different places, and we thought we have to play to win, and we can't play everywhere, and we're going to play to win in 3 disease areas where we think we have good science, we have good people, we can build scale, and we can be successful. This is cardiovascular metabolic diseases, diabetes in particular. And that's certainly the heritage of AstraZeneca here, of Astra in particular. Oncology, And finally, respiratory disease and autoimmune. And we've de-emphasized infections, vaccines, neuroscience, not because they're not important, but because we can't be doing everything. And our pipeline is actually growing so quickly that we will have over the next year or two to focus even more on those three core these areas where we can make a difference. We believe we have, in our industry, we are a little bit different, and we have capabilities that make us different and give us a chance to really be quite successful and compete. And this is what is marked here. We have capabilities in biologics. We acquired a company called MedImmune, which is based in Maryland near Washington a few years ago. We have tremendous capabilities in small molecules research coming from AstraZeneca. We have growing strengths in immunotherapy. In cancer in particular, the future of treating cancer is about unleashing your immune system to go after the cancer cells and kill them. And we have really tremendous scientists working on new immunotherapies, and we have a tremendous portfolio of products. We have great protein engineers, antibody engineers, people who come up with antibodies that are really very novel. And over the next 2-3 years, we're going to move into the clinic a range of very sophisticated antibodies that will have a great place in medicine. And finally, we have devices for inhaled medicines. You cannot operate in respiratory medicine, in asthma, in chronic obstructive pulmonary disease without these devices. So people can inhale their medicines. And we've bought a couple of companies over the last 2 years that have given us a range of devices that are extraordinary. And finally, we spend a lot of time and effort and money on personalized healthcare, what in the US the government now calls precision medicine. Historically, you would give a medicine to 100 patients, maybe 20 or 30 of them would benefit, especially in cancer. The future is about finding who are the 20 who would benefit, so you don't expose the other patients to side effects and the system to additional costs. So we spend a lot of time doing this, and we have about 70-80% of our pipeline has a personalized healthcare strategy or diagnostic test attached to it, so we can better target the medicines we develop. So in that, with this in mind, we are going through a journey, and it's a multi-year journey. As I explained to you, we're losing $16 billion of sales. So the question is, how do we replace this as quickly as possible? And it is a bit of a challenge. And this journey is made of 3 phases. The first three years, 2013, 14, and part of this year, we are busy rebuilding our pipeline so we could build a future for ourselves. We're moving into the next phase of our journey, which is next year in 2017, when we are actually losing 2 big products. Nexium, which you may have heard about, is the purple pill, and used to be a very, very big product, and Crestor, which is also an AstraZeneca product for the treatment of cholesterol. Those are multi-billion-dollar products, and we are losing Nexium this year, Crestor next year. And in the US, as I told you, it actually has a dramatic effect on the business. So over the next 2 years, we have to navigate these massive headwinds that are generated by patent expiries, and we're trying to grow the rest of our company as fast as possible. And by 2018, this company should really show a very healthy growth rate. In fact, in countries where we don't have Crestor, we don't have Nexium anymore already, we have a very healthy growth rate. So we have 3 pillars that we focus on. 1 is to build our scientific leadership. 2 is to try and return to growth as quickly as we can. And 3 is to continue building a great place to work. So this company is a company where people enjoy working and want to come and contribute. On the left-hand side, you see here what we presented to analysts and investors in May 2013, the first time we had an investors meeting and started on our journey. And we actually told them that by 2016, we wanted to have 9 or 10 new molecular entities in our late-stage pipeline. And I can tell you, with our chief medical officer at the time, we agonized for hours, wondering whether we would put 9, 10, or 7 or 8, because we were so nervous that 9 and 10 was not going to be achievable. And we thought, okay, well, we have to be ambitious. We had nothing in our pipeline at the time. We had absolutely nothing. And we thought 9 or 10 is maybe a bit stretched. In reality, we achieved 13 as early as 2014, and we had 15 products, and probably 15 is a stable level. So from a pipeline R&D viewpoint, we've done a tremendous progress, to the extent that our R&D budget this year has to grow more than we expected to fund this very rich pipeline we have. So we've made really, really great progress rebuilding our pipeline. This is what it looks like, and I don't want to go through all of this, but just wanted to show you that there are lots of products, and many of those products will get to patients very soon, and they will make differences. We have, a number of products in phase 3 in oncology, in cardiovascular disease, in respiratory disease. A number of them are under review. Tagrisso for lung cancer, I'll talk about it in a minute, is approved in the US already. So very rich news flow over the next year or two. Now, I don't want to bore you with scientific details, but just like Leif, I'm sure he falls in love when he looks at a truck. And I know traveling with Leif, he sees the mass, the Ericsson mass everywhere, the telecom communication mass. I can't see them, but he actually sees them and counts them. We in our industry can fall in love with the so-called waterfall plots. And those are waterfall plots that represent results when you give a product to a cancer patient. So this product is used for lung cancer with a certain mutation. Patients with lung cancer have sometimes a mutation called an EGFR mutation that triggers resistance to other treatment. 45% of patients in Asia with lung cancer have that mutation, probably more like 20-25% in the Western world. And so the reason I wanted to show you this graph is that, first of all, in our industry, you rarely see a graph like this. Each of these bars is a patient. And when it goes down, it's good news because it means your tumor is shrinking. And if you are here, you can see your tumor is shrinking by 100%. So it's really good news. When you are here, it means the product is not working for you. And so, you never see a graph like this. Typically, you have a number of patients who don't respond at all and a number who respond not as much as this. So the efficacy of this product is absolutely unique. And for those patients who have that mutation, it's a life or death kind of a question. Patients who have an EGFR mutation go on to a product called Iressa or Tarceva made by Roche. Iressa is made by AstraZeneca. But unfortunately, they develop cancer is smart. And those patients often develop another mutation called the T790M mutation, which makes the cancer resistant to Iressa. And at that point, patients progress and they typically die unless you can give them Tagrisso. So first of all, a unique product. But I also want to leave you a message because I'm sure you read and hear. Sometimes people say, why would we pay for these expensive cancer medicines that extend lives by only a few months? Now, the problem is, first of all, this product extends life by a lot more than a few months. But the problem on top of it is this is only an average. And even if the average is, in this instance, it's more than 10 months and the data are maturing, so it's going to be a lot more than that. But the average is only an average. If you are this patient here, it means, your cancer is gone. So you are in a really good place. If you are this patient here, unfortunately, it doesn't help you at all. So, the 10 months or the 12 months or the 6 months doesn't mean anything to you as a patient. What it means is, what is it going to do to me? And if you are the patient who responds, it is clear that you absolutely want this product. So our role as an industry is really to find new ways, new tools to identify those patients who actually benefit to justify the use of the drug and the cost that comes with it. Because this is the patient behind this water plot. And for that person, this is really, as I said, life or death. And I wanted to show you also this example because it is not only an example of great science, but it's an example that we can be very nimble as a company. We took this product from first in human in clinical trials to approval in the United States in 32 months. Usually it takes 8-10 years. 32 months. This is the fastest development ever in our industry. This is a compound that delivers 60 or 59% response rate in those patients. It's really completely unique. And our organization was able to ship product in the US the same day as we got approval. In the United States, typically you get approval from the FDA, and then it takes 2, 3, 4 days to ship product to patients. And everybody tries to do it as quickly as possible. We got approval on Friday morning. Friday afternoon, we were shipping already to patients and pharmacies, hospitals. And this was a tremendous work of collaborative work between Sweden and Italia that was meant to release the product and the United States. So a tremendous example that as a large organization we can be fast. And finally, a very good example of why we need to be focused on what we do and why sometimes mergers can be a distraction. This is a product that, if we had been distracted, if it had been delayed, we would not have been able to reach patients as quickly as it did. And I have seen patients myself, and I've seen the impact it has on them. There is a 1.6 million deaths through lung cancer in the world every year, so a very important medicine for those patients. But we keep working on this because the cancer keeps trying to outsmart us, and we try to outsmart the cancer, and it's a constant race. So some of these cancers will develop a new mutation that make them resistant to Tagrisso, to our product. And for instance, here this is a MET amplification, a specific mutation. So we're developing a new product, a c-MET that will, in combination with Tagrisso, block this resistance. And here is an example of a young female, 32-year-old, who had this kind of mutation and a metastasis in her neck. And you can see the effect that the product has on this person. So, this is really what our people actually come to work to make a difference to those patients. I also wanted to show you this one because this year, as you probably know, the winner of one of the Nobel Prizes is winning out of work done on DNA repair. And we have the best pipeline for DNA repair in the industry. We have a tremendous range of products. The DNA repair mechanism is about cancer cells repairing themselves. And with some of these products, we basically block these repair mechanisms and force cancer cell to death. And we have several products. And the first one is in the marketplace called Lynparza for ovarian cancer. And also we got this one approved a year ago very rapidly. And we're now working on different products that we will combine with Lynparza to actually improve the efficacy in a variety of tumor types, ovarian cancer, breast cancer, prostate cancer. And a lot of the work actually was done at the Francis Crick Institute in the UK by a Swedish scientist, as you would be pleased to know. So this is cancer. I just wanted to give you a couple of examples in other fields where we actually also try to make a difference to patients. Brilinta is a product for cardiac, for ACS, coronary syndrome, and also stroke, and a variety of other indications where your blood clots. And this is a product that was developed here in Sweden. We have a massive clinical development program, about 100,000 patients involved in a range of clinical trials going from acute coronary syndrome all the way to diabetes, peripheral arterial disease, stroke, etc. The product is in the market already. We believe we have already saved 20,000 people from dying from a heart attack or a complication through having this product in the market. A tremendous example of great science out of our Swedish organization. The development is done out of Gothenburg. And this product has multi-billion-dollar potential. This is another example of great collaboration between industry and academia, but also a great example of great Swedish science. A bit more than 2 years ago, we invested a lot of money in a company called Moderna in Boston that was develop a technology called mRNA, messenger RNA, to deliver RNA to cells and repair them. And we actually collaborated with this company and Karolinska, and we have founded a unit called the ICMC at the Karolinska that is leveraging this technology to improve outcomes in post-infarct. When you have a heart attack and you have an infarct, it essentially you have dead tissue, dead muscle, cardiac muscle, and you have to regrow it. And here with this technology, what we are able to do is to regrow vessels, and the vessels will regrow the cardiac muscle. And you see here at the bottom the control before and after the administration of the drug. There's no difference. And you can see here in the treatment group, we are delivering a product called VEGF-A, and VEGF is a compound that grows vessel. And you can see here in red, the vessels are regrowing, and those are functional vessels. So we believe this is an animal, but we believe that this has the potential to address the post-infarct damages that are created to the cardiac muscle, and basically rebuild the cardiac muscle and avoid that patient go into heart failure after a heart attack. So another great example of Swedish science and collaboration. So I wanted to do this to give you a sense for what it is we're doing from a science viewpoint. But let me just move on now and tell you a little bit about our company. We're based on 3 key strategic sites. One is in the United States, in Gettysburg, near the NIH, the FDA in Maryland. The second is Sweden, Gothenburg. The third is Cambridge. And we try to run Cambridge and Gothenburg as one single integrated unit. We've actually established an air bridge with a flight that goes back and forth every day between the 2 sites. So the 2 sites are working very closely hand in hand. We have a smaller one in Shanghai, but essentially in Boston, the 3 big ones are Gettysburg, Gothenburg, and Cambridge. And the newest one we're building is Cambridge in the UK. This is really a unique opportunity for our company. We're building this site that will open up in 2017. And it is in a place that is surrounded by some of the best academic institutions in the world. We call it to be at the heart of science, and we truly are at the heart of science there. This is the LMB, the Laboratory of Molecular Biology, that has probably the highest density of Nobel Prize winners in the world. This is the Addenbrooke Hospital. There is a new hospital called the Papworth, which is being built. There is the university, of course. There is the brain disease research unit. There is a metabolic disease research unit. All around us, there is the Cancer Research Center, which is the equivalent of the cancer unit of the NIH in the United States. So all of this is surrounding us. And the most exciting piece is our address is going to be 1 Francis Crick Institute. So for those Avenue, sorry. So for those of you who know who Francis Crick is, you can see that scientists will be quite excited working at 1 Francis Crick Avenue in Cambridge. So we're really looking forward to opening this site. We are trying to collaborate, as I said earlier, with as many units, academic units around the world as possible, and biotechs. And in Sweden, as you can see here, we have, out of our Swedish organization, a lot of collaborations, of course, with Scilaf Lab, of course, with Karolinska. I mentioned Moderna. We're trying to connect Moderna with Karolinska. So really trying to network with the outside world and this big ocean of science around the world. Let me shift gears and move from the science to our business. And what we've been doing is to replace those sales that we are losing so quickly. We've been trying to rebuild our key growth platforms. We identified platforms of growth in respiratory medicine, Brilinta, the product I mentioned to you, which we believe can be a multi-billion-dollar product, diabetes, the emerging markets where we have a strength, a tremendous presence, and Japan. And collectively, those are growing by 10% at the end of September. Now, you got to think about they represent 57% of our sales now. 57, they grow by 10%. And our top line in total is still declining by 2%. So it gives you a sense that 57% of our sales growing by 10% or more. It gives you a sense for the rest. The rest is totally collapsing. And so if we were not able to grow those and replace those sales with new products, basically the company would totally implode. So we are on this massive race to replenish our portfolio with new product and grow these products. We are investing in Sweden and around the world. We have made recently an investment in Russia. We have the biggest pharmaceutical investment in Russia. And as you know, Russians like everything in Russia to be the biggest in the world. So they were very happy that we had the biggest investment in Russia. But we also had large investment in Sweden and South Italia. This is our site here in South Italia, a big manufacturing plant for us. And we're building a $285 million biologics facility. Now, there are next steps after that, and over time, we believe we could invest up to close to $1 billion and create hundreds of jobs on the site. So this is going to be a very fundamental, very important facility for us. And that's why we believe that the work the government is looking at doing, reviewing the tax rate, is so important. In our industry, IP is critical. And companies tend to, of course, maximize their tax position. You have to be good at doing science, but you have to be good at managing your costs. You have to be good you have to have an attractive tax rate. So the tax rate in this country has to be attractive enough for companies to continue locating their facilities here and their profit. Otherwise, everybody tends to take their profit offshore like some companies do. We committed to staying here, and we pay a lot of taxes in Sweden. But it is very important to remain competitive because the whole world is a competitive place from that viewpoint. We have 6,200 employees in Sweden, 2,000 in Gothenburg, mainly in R&D, and close to 4,000 in South Italia, mainly in manufacturing, and also our local Swedish affiliate is there. Sweden as a country represents only about 1% of our sales. But we invest 25% of our R&D budget in Sweden. We manufacture 40% of our global volumes in Sweden. So it gives you a sense for the importance of Sweden to our company. But it also gives you a sense for the need we have for Sweden to be a competitive environment from a tax viewpoint, etc. Because we're not in Sweden necessarily for the Swedish sales that we derive from the domestic market. We export 39 billion SEK. And Swedish shareholders, in particular investors, are very prevalent and are very important shareholders for our company. I'll say a few words about the last pillar of our strategy. We really focus a lot of our efforts building a great place to work, making sure our people feel that the company is here to make their life easier, making sure our people feel that they make a difference. They come to work, they are happy to come to work, they are really happy with the job they do and really proud of the difference they make for patients and medicine. We try to write new medical textbook, new pages in the medical textbooks almost every day. And so we track how people feel about our company on a number of dimensions. And that measure engagement. We do this with 100% of the staff every 2 years. And we do this with a sample of individuals every 6 months. And we have about 85% of people who are engaged, which is an increase versus the past. But for those of you who look at this, you will know this is some of the best results across industries. 86% of our people believe in our strategy, which is a substantial increase on the past. 88% of our people believe that we have a scientific and patient orientation. This is fundamental to create that culture where people actually believe they can make a difference and like to come to work. 40% of our leadership is female. We can do better. We're not yet at 50%, so we keep working on this. But I think overall we have quite a diverse leadership team and a diverse workforce. We work a lot also on sustainability. Our goal is to be number one in the Dow Jones Sustainability Index. My previous company, Roche, is actually number one there. We want to actually beat them and be number one. So we have a number of initiatives in place to actually get there. We've made progress, but we're still not number one. And those initiatives range across, of course, things like energy efficiency. In our site in Cambridge, we'll have the second largest borehole in Europe. We have a variety of technologies in place to reduce energy consumption. But we also look at access, because we believe our role is not only to try and cure cancer. It is also to help patients in some parts of the world who have different issues than cancer access their medicines. I'll give you an example in Africa. In Africa, people think that the biggest killer is AIDS. Actually, the biggest killer in Africa is hypertension. 40% of African adults above the age of 25 have hypertension. And they die of heart attack, they die of stroke, they don't even treat their hypertension. And we have a pilot program in Kenya where we've already diagnosed 500,000 patients, where essentially we have an educational campaign. We try to diagnose patients, we try to convince them to treat themselves, and we sell a product that we make in China. We make billions and billions of tablets of this product in China at very low cost. And we sell this product for $1 a month, $1 a month. So cost is no longer an issue at that level of price. The issue is education, diagnosis, and convincing people to treat themselves. And I'm sure I'm not going to surprise any woman in the audience if I tell you that the biggest issue we have in Africa is to convince men when they are diagnosed with hypertension to treat themselves. Because they don't think they need to treat themselves. They think, I'm tough enough, I have hypertension, I don't need to take any medicine. So convincing them is really where we can make a big difference. So this is one of the things we also do, helping patients get access to our medicines. We don't look at our share price every day. Well, I do, but many of our employees don't. And we focus on what we do the best. But in the end, we believe that if we do our job well, it will result in good results for our shareholders. And this is our total shareholder return over the last 3 years. Since we started on this journey early 2013, this is the top 15 companies in market cap size on the FTSE 100. And you can see here our total shareholder return is 76%, and we are at the very top of the list. I'll have to admit that some of these companies, like the banks, have decided to implode and shoot themselves a little bit. And those companies here, of course, were impacted by the global economy. But certainly we are very proud of the results of our collective work and very proud of leading the FTSE 100 from a TSR viewpoint. But at the end of the day, we don't come to work for this. We come to work every day to achieve this bold ambition we have and really make a difference for patients. I know society doesn't always like pharmaceutical company, but I also know we can make a big difference, and that's really what we try to do, help medicine and help patients as much as we can. Thank you very much.
Thank you very much, Pascal. Before we start, some housekeeping rules. There is a microphone almost next to you at the seat. Use that because this is streamed. So people can look at this afterwards, but they can also look at it now live. So don't just speak up. And when you want to ask a question, please also tell who you are. Pascal, may I take the opportunity just to, first of all, thank you very much. I'm very excited about your sort of bold financial objectives and the fact that you have achieved this to be on top of the shareholder return list, but also the emotional message, which obviously is very important in your industry. And you sort of, as a person, also display that with great passion, which I think is important. And we, as I said, we as Swedes tend to look at Astra, as it once was called, and AstraZeneca now as a Swedish company in a sense. So we're very proud to hear you talk about this way. May I just start with the question that you said you're operating 16 countries, you're manufacturing 16 companies. You put 25% of your R&D in Sweden. When you come to decide on investments in various markets, what are the criteria that are driving your decision process? What is most important when you compare countries? And the subsequent question is, of course, since we are closing to Christmas now, are you here to deliver a Christmas present to the Swedes?
Yeah, well, you'll have to wait until tomorrow. We are going to make an announcement tomorrow. But there are two aspects of our business. One is science, R&D, and the other one is manufacturing. And when it comes to science and where we invest, essentially it's driven by the quality of the science in the surrounding environment and the quality of the science. I mean, at the end of the day, it comes down to people. So what is the quality of the scientists and the science you can interact with? that is really fundamental in driving our decision making, where we will build a research unit. When it comes to manufacturing, it's again about people. It's really, do you have the capabilities? Do you have people who are qualified, educated, able to manufacture good quality products and be reliable? And of course, Daniel, the next criteria, which is important, especially for manufacturing, is actually tax rates. And that's why I mentioned that, because, the problem is you can be, and there are examples of this in the industry, you can be a very successful, very productive company from an R&D viewpoint. If you don't have a good tax management, another company that will be a far less productive company, but a far more aggressive tax manager will actually come and take you over because they're better at managing tax. So we really need to have a good tax environment. But essentially, it's really people. And I think really Sweden has a unique opportunity here, because the people in this country are very well educated. There are really quite a number of strong academic institutions, as we all know. And we have a base of manufacturing that really has created a population of employees potentially that can work in our plant. So that was one of the decision factors why we built this biologics plant here in South Italia, is we know you can find very qualified, very reliable people here in this country.
Okay, thank you very much. Please, floor is free. Marcus Wallenberg. You have to use, you have that one next to your own seat too. That's okay. Yeah, we can.
So I'm Marcus Wallenberg. Yeah. So Pascal, I wonder if you just could spend a couple of minutes on describing the world of immunotherapies and the future potential, and why you think that AstraZeneca may have a possibility to be a leader.
Yeah, it's great. Thanks, Marcus. Yeah, the dream of leveraging your own immune system to kill the cancer cells has been something the scientists have pursued for many, many, many years, but it has been a dream for a long, long time. For the last 20, 30 years, people have been hoping to do that, and they were, they developed products many years ago that had lots of side effects and very limited efficacy. But over the last maybe 5-10 years, a lot of progress has been made. And essentially, the cancer cell is very smart because it hides itself. It hides itself behind a sort of a veil, so it is not recognized by the immune system. So essentially, we're developing products that remove the veil so the cancer cell can be recognized by the immune system. And we're developing other products that stimulate the immune system to go on the attack. So you have, your own immune cells can go on the attack and kill the cancer cells. So we develop a variety of products that either remove this veil or increase the attacks. And we combine them because the best way forward is to combine. We have there's a lot of competition and a lot of progress has been made. For instance, in melanoma. Melanoma is skin cancer. It's a terrible disease. Essentially, until 3-5 years ago, if you had melanoma, you were dead. The question was not whether you would survive. The question was how long would you be alive, typically 6 months or 12 months, but it was really a death sentence, a terrible disease. And with the introduction of immunotherapies, BMS basically introduced the first one. There are patients who've been alive for several years now. Not everybody responds, and we don't yet understand why they don't respond, but those who respond, they can be alive for many, many years and they live a good life. So we have, as a company, we have a tremendous scientists in the US, in Gettysburg, that understand the immune system and are able to also develop antibodies that do exactly what I described, remove the veil or stimulate our own immune cells, and we do a lot of combinations. We are quite advanced developing a combination that is in advanced clinical trials, and we hope to get approval for that pretty soon. We, as an industry, we are segmenting patients according to what we call PD-L1 positive or negative, so it's a type of patients. The immune therapies that exist today act on 25% of patients only, those who are PD-L1 positive, so-called PD-L1 positive. The PD-L1 negative, they don't respond, but they respond to our combination treatment. So that's really where we hope to make a difference. And this will be gigantic for us. If it works the way we hope it will work, the potential for this is just enormous. People expect this market to be a 40, 50, 60 billion dollar market because, of course, if you can cure cancers that are really death sentences, the potential there is enormous.
Please, Michael. Michael Treskov.
Michael Treskov. Pascal, it's impressive to see your journey. It's easy to understand the graphs of your pipeline, but could you help us a little to understand what's behind that success? Because, I mean, it's what I understand in your industry is dramatic, what you have achieved, that pipeline that's now going to create those possibilities for the future. What are the drivers? What are the, I guess it's not pure luck.
Actually, the main driver is AstraZeneca is full of great people, and I've worked in a number of companies, but the people at AZ, they really are. First of all, we have quite a number of good scientists, but essentially they are people who actually want to do well. They want to make a difference, and they want to do well, and essentially what I and my leadership team over there and others over the last 2 years have tried to do is mobilize them around a few things that we can impact and give hope, because we were in a position where people were losing hope a little bit, and showing them that we can make a difference has sort of energized everybody, encouraging people to take a risk. This is an industry where if you don't take any risk, you don't innovate, as you know very well. And if you take risk, you're going to fail from time to time. And the best way to not fail is to not take risk. And so we were in a position where we were not taking any risk and not failing, of course, but also not developing anything. So really giving people the sense that they can make a difference, they can succeed, is really what has changed everything. Because fundamentally, a group of good people, good scientists, people who want to make a difference. And I have to say that what happened last year to us was a defining moment. And in fact, we should, I certainly thank our colleagues at Pfizer in New York for approaching us, because it actually created a sense of urgency, which we had worked on creating before, creating this sense of urgency to change, because time is of the essence. But basically, this approach created a sense of urgency that was even bigger. And everybody around the company looked around and said, what do I do to make this company even more successful? So 921 Tagrisso, 32 months, I tell you, everybody was working as fast as they could. Brilinta, we filed a new indication for extended treatment after acute coronary syndrome. People did this in a record time. They worked overnight during Christmas. It was like incredible. The sense in Gothenburg, I was there a few months ago to celebrate with them. The sense of energy and urgency was tremendous. Yeah. So it has really created this. And then when people succeed, success, as we all know, success breeds success, and they gain confidence, and they try to do it again and again and again. Yeah.
Mattias Åhlén, I was almost waiting for you to say something. Please.
Pascal, the journey you're describing is amazing, and I'm very, very impressed about that you're transforming AstraZeneca into a very modern company with a mixture of chemicals and biologicals. So my question is, very long term, maybe 20 years or 25 years from now, what do you think would be the mixture of biologicals and chemicals?
Yeah, it's a great question, actually, Matthias. Probably not even so much long term. I think if you look at our pipeline, today it's about 50% small molecules and 50% large biologics, essentially. So it's a sort of 50-50 already. So the number of biologics in our pipeline is quite large. So I think over the next 10 years, the portfolio of products in the marketplace, in our case, will be probably 50-50, biologics, small molecules. And then beyond that, I think there will be new modalities, for instance, mRNA, new delivery technologies. So the pipeline will actually fragment into different type of products. And it is really fundamental for us as a company because as I said earlier, when you lose patent protection on a small molecule, you completely evaporate in about 6 weeks or so in the US. It's a bit slower in Europe, but in the US, you lose your cells very quickly. But with biologics, you decline more slowly, so you have more time to rebuild your future. So having more biologics will also help transition from older products to newer products.
Björn Schaven? You have to push. It should be red, otherwise you shouldn't speak.
Thank you. So my question is, we have 2 sites here in Sweden, Södertälje and Gothenburg. And historically, it seems that the Gothenburg site has been more successful, much more successful in delivering successes. I know your chairman is from Gothenburg, but can you identify any characteristics why you think it's been more successful in Gothenburg? We need to learn here in this part of the world.
Yeah, I don't know that I can answer this question actually because the Södertälje site was closed before I joined the company. So Södertälje today is really a manufacturing site for us. It used to be a research site, and the decision was made to close Södertälje research before I actually joined the company. So I don't know that I can make a useful comparison of Gothenburg and Södertälje. What I know is that we've really been working very hard to build Gothenburg as a tremendous place to attract talent. It was really, it's interesting. 3 years ago when I joined, everybody in the company was telling me, you can't attract good scientists in Gothenburg. Nobody around the world wants to go work there. And I went there and I thought, I like this place. Why would it not be possible? So we've worked hard to attract people. And I tell you, today we attract some of the best scientists from everywhere. We have people who come from Harvard. We've got people who come from everywhere around the world, California. And we have, I don't know how many nationalities now, in 50 nationalities in Gothenburg we have. We've worked hard to renovate or reshape a little bit the buildings because it was a bit old and fragmented. We are actually reshaping, bringing people closer to each other so they can interact, so they can share ideas. Creating this kind of opportunities for them to talk to each other and attracting people. We have renamed it, we are in Mondal, but we are now calling it Gothenburg. Small things like this. So when you try to recruit someone out of, Japan or Australia or somewhere, you say they take their family to the Gothenburg website. And when you look at the Gothenburg website, believe me, you want to go live there. And so a lot of the school with Jan Olaf has worked quite a bit to help the international school. That's really what we try to do, so we attract the best people there. Yeah.
Do you have a short
follow-up?
follow-up?
Very follow-up on the expert. Does the Swedish expert tax regime for 3 years make a difference for you there?
The tax regime doesn't make a difference to our ability to attract talented scientists. It's really more of a manufacturing piece. And it's also very much so that, we remain a competitive company. The government has to help us be competitive. Because if we are not competitive, someone else is going to take us over and then manage our tax better. So we have to be helped to remain a competitive company, also from a tax viewpoint. It's not only all about science. That's maybe unfortunate, but that's the reality of life. Yeah. But from a scientific viewpoint, really tax doesn't really make much of a difference. We really have to have the best science, and not only having the best scientists, but the best connectivity to to, for instance, Matthias's lab, the SciLife lab, and Karolinska, and many others around the world.
We have the last two questions now, unfortunately. You are first, and then you.
Thank you very much for this. I'm Ulf Hall from the Knowledge Foundation. I'm very curious about your leadership style, because you are present in so many different countries. There's the Scandinavian management style we got from the US, and I can imagine Russians lead their companies in different ways. What are your leadership style?
Well, I don't know if there is any nationality to attach to my style. I mean, I've lived in Australia, I've lived in Japan, I've lived in California, I've lived in New Jersey, I've lived in Switzerland. I'm sort of based in the UK now. You know, the one thing I've learned, I sort of see myself as a citizen of the world, really. My children live in Australia. I've got a grandson who hardly speaks French, actually. So I've learned one thing over the last 30 years is the value of diversity. And the value of having not one style, but many styles, and bringing a group of people that have different horizons, different ways of thinking. You know, in our industry, if you want to be innovative, you have to have people who come up with different ideas. And the best way to do this is to have people from diverse backgrounds. So we try to suddenly build a team that is quite diverse. On the leadership team, on my leadership team, we have people from different nationalities, different parts of the world. And my style is to welcome this, to try and bring people have different ways of thinking, and create an environment where everybody has their level of autonomy, everybody is clear about their responsibility, their accountabilities, but we all share a common goal. And we have a single common goal, which is what I showed you before. Yeah.
Please.
Thank you for a good presentation. My name is Chris Trevensen. I work with innovations in water. And since the body consists of 70% water, it's a very exciting area when it comes to health and healthcare. My question to you is, if you look at the big pharma is normally accused of focusing very hard on profits. And I'd like to hear your comments on something is quite wrong with the whole model in society, because it's a repairing society. 10 years ago, I was working in the fitness industry, and I had a look at, in Gothenburg city, 16,000 Swedish crowns was spent on curing, and only 85 krona was spent on preventive healthcare. So since the big pharma is wanting to have medicines taking for a long time, and the patient actually wants to get cured immediately, it's a very interesting opposition between those. So I'd like to hear your comments on that, please.
Actually, our goal is not to keep patients on a treatment for a long time. Our goal is to cure them, in fact. But the problem is, you know, medicine is complicated, and in many cases you actually cannot cure patients. But when we can cure them, we do that. And in fact, the price you can actually derive from a medicine is very simply linked to the benefit you bring. So if the benefit you bring is actually you can cure the patient, you get an even better price. In the UK, where they have a committee called NICE, the National Institute of Clinical Excellence, this committee decides on the level of pricing a medicine can attract. And they have a very sophisticated mechanism, and they look at what they call the cost per quality. Quality is quality of life adjusted years. So they look at how many years of patient's life you add and the quality of that life. And they give you a cost per quality, and they say above 30,000 pounds cost per quality, then your product is actually not going to be reimbursed because it's not cost effective. In this setting, which is one of the most challenging one in the world from a pricing viewpoint, if you cure patients, you get a better cost per quality and you get a reimbursement. So we're not trying to keep patients on drug for the rest of their life. It is not good medicine, and it's really not good economics for us anyway. The general question about price in the industry is a great question, but the reality is that this is a very risky business. You look at all these companies that are merging because they can't survive on their own. And investors who place money in a pharmaceutical company place their money in a company that is quite a risky venture, really, because if you don't succeed, if your R&D is not good enough, you're just going to go down. And then there's nothing you can do about it. So that's basically what it's about. It has to have some reward for taking the risk. It cost about $2 billion, including the cost of failure. It cost about $2 billion to bring a medicine to the market. So developing a medicine is almost the same cost as developing a new plane. It's an enormous investment. And one of the issues that I think society hasn't been able to reconcile in a way is you would need longer patent protection in a way, and maybe a lower price. Because you have to recoup, your investment over the duration of your patent and the price level. So if you had longer time, you could have a lower price. And so those are the two dimensions. But I think there's another dimension to price that people completely miss, is that society has to invest a certain amount of money for a number of years, 10 years, 15 years, depending on how long your patent is. And for 10 years, let's say you pay a relatively high price for your medicine. And then society has this for free for the rest of history. I'll tell you a little story about, that really struck me a few years ago. My grandson was 6 months old, and I was in Australia. It was Christmas, and he developed a urinary tract infection. Really kind of very common infection. He had a urinary tract infection, and everybody panicked. And at home, of course, we took him to the hospital. Went to the hospital. The doctor looked at him, said he has a urinary tract infection, gave us a prescription to go buy Bactrim, which is an antibiotic that was developed by Roche, my previous company, many, many years ago, and is now on the list of the essential drug list of the WHO. We went to the pharmacy, bought this pack of Bactrim for $4. Gave him Bactrim, infections went away, and he cured. So we cured him for $4. And I thought to myself at the time, 50 years ago, without this product, his urinary tract infection, which was a very modest infection, would have turned into a kidney infection. He probably would have died. Or he would have stayed for the rest of his life with damaged kidneys and living a bad life. We saved his life for $4. And, for a period of time, society paid Bactrim a high price. Then it went generic. Now it costs $4 a pack. And this is really what society can benefit from. Forever now they can buy Bactrim for $4. So pricing is sort of is not an issue you can look at today. You have to look at it from a societal perspective and over a long period of time.
Pascal, I think unfortunately we have to stop now. We usually try to stop around now. I mean, we could go on for hours here. First of all, I really would like to thank you, a citizen of the world working in a business area which is obviously extremely important and even can help your grandson be cured. Isn't that good?
It's nice.
Particularly now. Thanks a lot. I think
you so much.
Shared some good stuff today. Thank you very much.